Deputy Catherine Connolly to discuss the constant threat of closure of Clifden District Hospital.
Carmíl Magat, Chahirli, agus ara farir a rasharís goji an táwer seo, agus tá sagum go bhfuil sim agat sa scéil seo, ach tá mé a rasharís agus an ceis seo á ordú agam cosú le mo cholaici birte scaile an teacht éimeann ó cuimh agus mar réad farm nuair a bhí mise sa chathaoir ag gol siar goji dearad fómhair agus farir ní léon dul chun cinn. Tá muid ag leanach de rá agus an Baineann i gcónaí go núnthaí an Ospidéal. Ospidéal atá lárnach don Ceantair, Ospidéal atá Harbh tábhacht tá chun an brú a laidú ar an Ospidéal in Ngáile agus an méid sin buntáiste eile. Minister, unfortunately I'm back with Clifden District Hospital. I'm hoping you might have some good news tonight. I doubt it, but I hope you do, because we're now back, we're still in the situation. As you know, my two colleagues raised it back in October when I was in the chair. We did that as one voice. We had meetings with staff, we had meetings with the union. And I'm going to put this in context for you, because the HIQA report visited the Clifden District Hospital in the middle of COVID, in the middle of the pandemic. And their conclusions on 6 measures were that they were fully compliant on 3 of them, substantially compliant on 2 of them, and partially compliant on 1 of them. That's a pretty good judgment from HIQA. They go on to point out that the feedback from the patients was absolutely positive. They note some difficulties with the infrastructure, in particular, not enough showers or not enough showers geared to gender, lack of sinks, and problems like that they brought to their attention. But overall, this hospital in the middle of COVID got a thumbs up from HIQA. If you look at the 6 measures, 3 completely compliant, 2 substantially, and 1 partially. And the one that was partially identified was eminently, in relation to it. So there were, on the day that they visited, they said the hospital comprised 21 beds, 19 of which were occupied. They were glad, in a sense, everybody, because it left more room and more manoeuvre in relation to COVID. The hospital accommodated, and this is what's interesting, accommodated patients requiring rehabilitation, convalescent and palliative care. Patients were admitted to Clifden District Hospital from the University Hospital in Galway, and inspectors were informed that admissions direct from the community to the hospital were stopped, but only stopped because of COVID. So up to that point, there were referrals from the community and referrals from the hospital, and I don't know where else the referrals were coming from. And so that's HIQA. And then we have the local doctors who you're very familiar with, and they don't often go out on limbs, do they? GPs. And here we have a GP begging for the hospital, imploring the health executive, Dr. Casey, who's been there, I think, 50-something years, and his son is with them now, imploring us to restore the hospital and go back to the functions it had. The unions are telling us, and again, I don't think it's either my place or your place to be in between unions and a thing, but what the nurses are saying, they have orchestrated this downgrading of the hospital because we believe they want it for another purpose they have not yet revealed. If you don't advertise you're open for business, you won't get the business. Finally, we've been given lots of contradictory reasons by the health executive in relation to this. One, they can't get staff. Then they went on a special recruitment campaign, got over 20. So many were shortlisted, but in the end they got 1 nurse. That's not available till 24. Now there's something seriously wrong, and this is the best recruitment campaign after, am I over time? So I'm not sure.
Yeah,
I'll stop, I'll keep the rule and come back. Yeah.
Thank you, Chair. And it's seldom you hear a minister say, let her go on. Thank you. Let me begin by saying, Deputy Connolly, I'm taking this on behalf of Minister Butler. She's dosed with a flu and she asked me just to take it, so it's important. So I will take her script. So I would like to thank you, Deputy Connolly, for raising this important matter. And as I say, I'm taking it on behalf of Minister Butler. I would like to begin by acknowledging the vital healthcare role that Clifden District Hospital plays and the excellent level of care and support which it provides to patients and their families in the Clifden community and surrounding areas. First and foremost, I would like to reassure the Deputy that there are no plans to close Clifden District Hospital. However, we are aware of the various challenges that Clifden Hospital is currently facing, and I would like to assure the Deputy that Minister Butler is committed to working alongside the HSE Community Healthcare West to address these issues. As you will be aware, Clifden has been primarily designated to provide convalescent care to patients stepping down from the acute hospitals. Clifden Hospital also provides respite beds to allow family carers in the community a welcome break. However, with the evolution of Sláinte care and the transition of care from acute to community settings, the needs for these step-down beds has reduced. In the Clifden area, there has been significant challenges over many years to secure significant nursing staff, despite national, international and local recruitment drives. This is the case both in the Clifden District Hospital and in St Anne's Community Nursing Unit, a designated centre registered with HECWA to provide a home for older people. HSE Community Healthcare West is keeping with its commitment to political representatives. Its staff and their representatives undertook a bespoke nurse recruitment process in October last year. At a minimum, 4 additional nurses are required to sustain the current residential older people services in both St Anne's Community Nursing Unit and the Clifden District Hospital. The HSE will continue to undertake bespoke campaigns to fill these vacancies, but continues to face challenges filling these posts. Community Healthcare West has assured Minister Butler that they will continue to review service needs and what services can be provided based on the staffing available. They will continue to engage with staff, unions, GPs and political representatives in this regard. And I would like to inform the Deputy that the HSE Community Healthcare West met with the local GPs in November. The GP engagement involved an initial meeting with the HSE management and a follow-up meeting with a consultant geriatrician. The consultant geriatrician outlined the integrated care programme for older persons, or ICPOC, services being rolled out as part of the enhanced community care programme, including the visiting satellite clinics based in Clifden District Hospital. Minister Butler was delighted to hear that the visiting clinic commenced last month and an expected monthly service from the consultant geriatrician and twice monthly services from the ICPOC team incorporating physiotherapy, occupational therapy, dietetics and nursing. This is a welcome addition to the services provided in Clifden District Hospital. I would also like to mention that the day service remains in operation in Clifden District Hospital and a new bus service is available to the day service. Community Healthcare West are also aiming to expand this day service, and it is important to highlight again that there are no plans to cease service or close Clifden District Hospital at this present time. And Minister Butler will continue to engage with the Chief Officer in the Community Healthcare West to ensure that continuation and possible expansion of services in Clifden. And for the 5 seconds I have as a Minister in Galway, I certainly would like to see the Clifden District Hospital to remain in full operation. I give my full endorsement to its operation, knowing the geography as I do of the county chair. It's very important that when we talk about Galway, I can leave my house in Portumna and be in Leinster House quicker than I will ever be on the far side of Galway City. So it's very important to understand the size of Galway, the geographical need, but also the ageing population that we have and the value that Clifden District Hospital plays in its community.
Thank you very much. Thank you very much, Minister. And I want to acknowledge your positive comments and what you're putting on the record. And just again, in context, do you know many people were on trolleys today in a centre of excellence in Galway, although I've been corrected for calling it a centre of excellence because that's only in relation to cancer care. But nevertheless, it serves an area of almost 1 million people, as you know, 800,000 up to 1 million, 42 patients on trolleys today. So any talk of closing Clifden Hospital, which it closed during Christmas and it closed in November because they had no staff or they couldn't staff the nursing home and they're moving staff back and forth. There's an ongoing dispute, as I understand it, with the union in relation to that. But what I'm most unhappy with is the hospital has closed twice in an area that you recognise it's vital. It's vital to take the pressure off the regional hospital. It's vital because of the elderly population, and that's increasing, as Dr. Casey has repeatedly pointed out. And he's also pointed out the range of services that could be given in there to take pressure and to centre it. I worry when I hear no plans to close it at the moment. That worries me. And it worries me the way language is used as well when we get a little lecture on primary care and the geriatrician telling us the good things. We know that, that's brilliant. I'll be the first. I praised when we had the meeting and we learned about primary care on the ground. I worked in primary care. But it's no substitution for a hospital that gives services. And look, when I ask why are services not available, for example, Minister, in Carrow, why are there not respite beds? You know what I'm told? They're in Clifden. They're my answers. Merlin Park is the primary place for respite beds with 13, and I'm told Clifden has 12 respite beds. So I go round in circles with all this paper. So even on respite beds alone, there's a need for Clifden on their own figures, not to mention convalescent, not to mention other possible sources of services that should be there.
Thank you very much. And I've continued to keep to the script. The provision of short stay beds, including respite beds, is an integral part of the integrated model of care for the provision of services of older person. And I am aware that these services provided in Clifden District Hospital are highly valued across the wider community and within older person services in the Community Healthcare West. Unfortunately, short stay capacity in public hospitals and community nursing units can be impacted for a number of reasons, including HIQA, but as you have said in your report earlier on, HIQA have found no faults there, infection prevention controls and staffing challenges. As I've already outlined, we are very aware of the challenges that Clifden Hospital is facing, and I would like to advise the Deputy that the HSE has assured the Department that they are committed to providing service to older people to meet the demands for services in short and longer term for people in Galway. Minister Butler is delighted to hear that the Integrated Care Programme for Older Persons is launched at Clifden District Hospital last month, and I'm still okay. The ICPOC services ensure that older people with complex care needs can access care quickly or at near home through care pathways specifically designed for older people and targeting frailty, falls and dementia. This service is a welcomed addition to the Clifden District Hospital. To conclude, I want to ensure the Deputy that there are no plans to close Clifden District Hospital, and I would like to reiterate that Minister Butler is fully committed to working alongside the HSE to ensure that services in Clifden Hospital continue. And can I, for the 30 seconds again that's left, Chair, can I say, I think I have to compliment Breda Crehan-Roach in the work that she's trying to do, but if I was to lean on her to say it is really vital that at all times that the service stays open. We cannot have an ad hoc approach that it opens and closes. We need to ensure that the staffing, even if it's relief staff coming from community healthcare in the city, has to be provided out. We need a pragmatic approach to ensure at all times Clifden District Hospital remains open and the people in the community are reassured that that service is stable and responding to their needs.